Hi, my name is Shelly Evia, and I am a second year student at the University of Connecticut School of Pharmacy.
Hello, my name is Angela Singh, and I'm a third year student at the University of Connecticut School of Pharmacy.
COVID or coronavirus has been one of the most recent health concerns affecting many people. Since 2020, there has been many new developments regarding coronavirus, such as the novel vaccines we now have.
Today, we will be presenting information about COVID-19 vaccine updates to raise awareness and educate others about current vaccine regulations.
In our current fight against COVID-19, the FDA and CDC are constantly updating rules and regulations about the different treatments and vaccines. Our presentation will talk about recent and relevant information about the vaccine and how you will be able to protect yourself and others against the virus. We will first talk about general information about COVID-19.
COVID-19 is an upper and lower respiratory tract infection, which can affect the sinuses, nose, and throat, as well as your windpipes and lungs. An individual may start to experience symptoms 2 to 14 days after exposure to COVID. These symptoms may be fever, coughing, difficulty breathing, fatigue, loss of taste or smell, and congestion. COVID is highly contagious and is spread through respiratory droplets when an infected person coughs, sneezes, or talks. This is why wearing masks, social distancing, and getting vaccinated are important factors in minimizing the spread of COVID.
This chart displays the course of infection in an unvaccinated individual. When you are unvaccinated, your body produces antibodies, beta cells, T cells, and other immune cells that will increase your immune system's response against infections and prevent any further progression towards a more severe infection. Unvaccinated individuals have a higher chance of developing a severe infection. Typically, in an unvaccinated individual, the viral load is at its highest 2 to 4 days after symptom onset. This is because your immune system will need about 2 to 4 days to create the proper antibodies to fight off the infection. After days 2 through 4, the viral load should decrease as your immune system combats the virus. The entire course of infection of COVID-19 typically lasts about 14 days and can range from mild to critical illness. More severe signs of a COVID-19 infection occurs when a person needs to be hospitalized, has severe shortness of breath that impacts daily activities, develops acute respiratory distress syndrome that decreases oxygen in the body and needs to be admitted into the ICU. Vaccination is imperative to reducing the risk of a severe infection from coronavirus.
COVID-19 is a virus that binds to the ACE2 receptor and transmembrane serine protease 2 on the host cell. The transmembrane protease is an accessory protein that is expressed in the airway epithelial and vascular endothelial cells. Once the virus binds to this protein, it has the capacity to cause a respiratory tract infection. Once the viral genome is integrated into the human cell, it gets replicated within the host cell. Through this mechanism of action, we are able to understand why the Omicron variant is less severe versus other variants. Omicron's inability to bind to the transmembrane protease causes it to only be located in the upper respiratory tract, making it less pathogenic and less severe than other COVID variants.
Next, we will get into information about the three different types of COVID-19 vaccines that are FDA approved and available in the US.
Here's a general overview of each brand of the COVID vaccines. There are 3 current vaccines that are approved under emergency use authorization by the FDA based on safety and effectiveness data. Typically, it takes about 10 or more years for a vaccine to be developed, tested, and approved. However, due to the urgency and severity of COVID that we all experienced, manufacturers were obligated to develop a vaccine in less than a year to be approved by the FDA. Pfizer and Moderna are both mRNA vaccines. Pfizer was approved first under emergency use authorization on December 11, 2020. Moderna was the second approved vaccine under emergency use authorization on December 18, 2020. Jansen is not an mRNA vaccine, but is a replication incompetent adenovirus vaccine manufactured by Jansen and Jansen, and it was approved on February 27, 2021.
The Pfizer-BioNTech COVID vaccine is a total of 3 or 4 doses depending on the status of your immune system. Immunocompromised individuals have a weaker immune system than immunocompetent individuals. For both the immunocompetent and immunocompromised population who are over the age of 5, the primary series consists of 2 doses, with each dose separated by 21 days. The booster dose is at least 5 months after the second primary dose for immunocompetent individuals and at least 28 days after the second primary dose for immunocompromised individuals. The booster is recommended for people over the age of 12. A fourth total dose is recommended for immunocompromised individuals over the age of 12, 5 months after the first booster shot, or third total dose for additional protection. The Pfizer booster is only recommended for individuals who are 12 to 17 years old. Anyone 18 and over can get any brand or manufacturer of the booster shot.
The Moderna vaccine is approved for 18 years or older only. After the primary dose, there is a 28-day interval until the second dose can be administered. For immunocompromised patients, a booster shot or third shot is recommended 28 days after the second shot. A fourth shot is recommended for immunocompromised patients at least 5 months after the third dose. For immunocompetent patients, a booster shot or third shot is recommended at least 5 months after the second dose. It is also important to note that the booster shot can be of any manufacturer, while the first two shots should be from the same manufacturer.
The Jansen vaccine from Johnson & Johnson is only for 18 years and older. It is a one-dose vaccine, and it is recommended to get a booster dose 2 months after the primary dose. If you receive the Janssen vaccine, you are eligible for a booster from any manufacturer. It is also important to note that unlike the other two vaccines, an additional primary dose is not authorized for immunocompromised patients. mRNA vaccines, such as the Pfizer and Moderna vaccines, have a better efficacy and are recommended over the Janssen vaccine.
After receiving a dose of the COVID-19 vaccine, you may experience some mild to moderate side effects shortly after. It is important to note that these side effects are adverse reactions from the vaccine and not a side effect of COVID-19. Possible immediate side effects that you may experience about 15 to 30 minutes after vaccine administration include pruritus, urticaria, flushing, swelling around the vaccination site. You may experience shortness of breath or wheezing, and your heart rate may noticeably increase or decrease. Other possible immediate adverse reactions include nausea, vomiting, abdominal cramps, and diarrhea. About 1 to 3 days later, there are still possibilities of adverse delayed reactions. Delayed side effects may include fever, chills, fatigue, or pain at the injection site.
There are a variety of ways to relieve side effects from the COVID vaccine, including pharmacologic and non-pharmacologic interventions. Over-the-counter medications such as ibuprofen, acetaminophen, aspirin, and antihistamines can relieve arm soreness, injection site pain, swelling, and itching. Moving the vaccinated arm is also important in relieving pain and soreness. Staying hydrated and applying a cool washcloth over the injection site are also helpful ways to reduce side effects. Note that you will be asked to stay seated for 15 minutes after being vaccinated. This is to ensure that if you do experience any immediate side effects, the healthcare professional on site can help you. So if you are someone that feels uneasy about the possible side effects of the vaccine, remember that you will be monitored afterwards to ensure that you are safe, not reacting adversely, and in good hands if you do experience side effects.
There are some considerations when picking which COVID-19 vaccine to get. It is important to note that if you have any allergies, specifically to PEG polysorbate, as these are common ingredients in mRNA vaccines. It is also recommended to consult with your doctor before receiving the vaccine if you do have any severe allergic reactions to any vaccine or injectable medications in the past. Those with autoimmune deficiencies should also consult with their primary care doctor before receiving any vaccine due to their higher susceptibility and risk for severe illness. Individuals that were recently diagnosed with COVID-19 are recommended to delay their primary dose until 4 weeks after the onset of symptoms or since they have had a positive test. Recently diagnosed patients may get their second dose after completing their isolation period, have had an improvement in symptoms, and have had no fever.
The CDC is a great resource to find many statistics about COVID-19 and the vaccines in the US or in your current state. On the left side, the chart displays the amount of COVID-19 vaccine administrations by vaccine type. As mentioned before, mRNA vaccines are more sought out and effective than other vaccines. Pfizer is currently the leading manufacturer of COVID-19 vaccines, while the Janssen vaccine is significantly behind. More than 300 million individuals received the Pfizer vaccine, while about 200 million received the Moderna vaccine. On the right side, we see the total doses administered in each state per 100,000 of the total population. We can see that each state is at least 1 to 100 120,000 of the total population is vaccinated, and that Connecticut is more than 200,000 of the total population is vaccinated, making Connecticut one of the leading states in vaccinations.
It is important to note that there are several different ways for yourself and your community to get vaccinated. The first way is from your primary care provider. You are able to call your primary care office and inquire about receiving the COVID vaccine. Your primary care provider should also have vaccines on site or be able to give you additional information on where you can get your vaccine. Another way to get vaccinated is through your local pharmacy like CVS. You can schedule an appointment online or by calling your local pharmacies to get your vaccine or booster shot. You can also find a COVID-19 vaccine clinic in your area or somewhere near to get fully vaccinated or get your booster shot. COVID-19 vaccines are available to all eligible individuals and are no cost with or without insurance.
And that concludes our presentation. We would like to thank you for listening, and please do not hesitate to contact us via email with any questions, comments, or concerns. Thank you.